Have you ever felt a strange heaviness in your legs after a short walk and wondered if it was really just age catching up with you? A patient of mine once shared that her feet had been feeling unusually cold for months, but she brushed it off as poor circulation or the weather. And I want you to imagine this for a moment. Picture yourself going through your normal day when a small discomfort appears. It seems harmless, maybe even familiar, but deep inside your arteries, something much more important may be happening. I'm Dr. Evelyn Carter, and after more than 30 years of caring for older adults, I've learned that the changes happening inside our arteries after 60 are often silent. They don't shout, they don't demand attention. Instead, they quietly narrow and stiffen year after year, raising the risk of heart attack, stroke, and circulation problems long before anyone feels a dramatic warning sign. Many seniors don't realize this because the early symptoms look so ordinary. A little fatigue, a little dizziness, cold feet that never warm up, a sense of heaviness in the legs, even mild chest pressure that comes and goes. These moments get dismissed as normal aging, when in reality, they're often the body's first signals that the arteries need help. What makes arterial health so tricky is that the damage doesn't appear overnight. It builds slowly, over decades, one small layer of plaque at a time. By the time symptoms become obvious, the arteries may already be struggling to deliver oxygen to the heart, brain, and limbs. That's why protecting your arteries early is one of the most powerful things you can do for your long-term health. And the beautiful part is that even after 60, the heart and arteries can still improve. With the right habits, the body responds. Blood flow gets better. Blood pressure stabilizes. Energy returns. Healing at any age is possible when we understand what our body needs. In today's video, we're going to explore what really happens to the arteries after 60, the hidden signs most seniors miss, the everyday habits that quietly damage circulation, and the steps you can take right now to protect your arteries before serious problems begin. Stay with me, and if you find this helpful, make sure to subscribe so you never miss another life-changing lesson here on Senior Health Daily. Let's take this journey together, one step closer to a healthier heart and a stronger future. How arteries change after age 60. As we step into this next part of our conversation, I want you to picture your arteries the same way you might picture a long, flexible garden hose. When the hose is new, water flows smoothly. The walls are soft, elastic, and responsive. But as years pass, that same hose becomes stiffer. The surface becomes less flexible, and the flow inside isn't as smooth as it once was. Your arteries change in very much the same way. After the age of 60, arteries naturally begin to stiffen. It's not a sign of failure, it's simply a part of aging. The elastic fibers inside the artery walls start to break down, and tiny calcium deposits can begin to settle in. The inside lining becomes a little thicker, and the smooth flow of blood requires more effort from the heart. Many seniors don't notice these changes at first because the body is beautifully skilled at adapting. But adaptation comes at a cost, and over time, the heart must pump harder against these stiffened pathways. Plaque also begins to build slowly and quietly. This isn't a sudden event. Instead, it happens over decades. Cholesterol, inflammation, and calcium all play a role in forming these small deposits. Think of plaque not as a giant blockage, but as layers building one on top of another, narrowing the pathway little by little. For many older adults, this buildup has been forming since their 40s or 50s without them ever realizing it. By the time symptoms appear, the arteries may already be struggling. Another part of this story involves a tiny molecule called nitric oxide. It's something our bodies naturally produce to help arteries relax and expand when more blood flow is needed. But as we get older, our production of nitric oxide decreases. That means arteries have a harder time widening the way they used to. A senior walking up the stairs may suddenly feel out of breath, not because their lungs are weak, but because their arteries cannot expand quickly enough to deliver oxygen-rich blood to their muscles and heart. This is why seniors often feel symptoms only when the arteries have already become significantly narrowed. At rest, everything may feel perfectly normal, Blood might still get through, but the moment the body demands even a little more oxygen, the discomfort begins. Maybe it's heaviness in the legs, maybe it's mild chest pressure, maybe it's a wave of dizziness when standing. These symptoms seem small on their own, but collectively, they tell a clear story about circulation. From my years of caring for older adults, I've seen how easy it is to overlook these changes. People say, "I'm just getting older," or "I'm a little tired today." But arteries don't stiffen overnight. These changes accumulate slowly, and this slow buildup is exactly why awareness matters. When we understand the invisible shifts happening inside our arteries, we begin to see how essential it is to protect them before the damage becomes more difficult to reverse. Now that you understand how arteries change after 60, let's take the next logical step. What are the signs that these changes are already happening? Some of them are so subtle that most seniors miss them entirely, and that's where we're headed next. Hidden warning signs. Seniors often ignore. Now that you understand how arteries change quietly after age 60, the next question becomes even more important. How does the body signal that these changes are happening? The truth is, the early warning signs are rarely dramatic. They don't stop you in your tracks or send you rushing to the hospital. Instead, they show up as small, familiar sensations that most seniors dismiss without a second thought. One of the most overlooked signs is leg cramps or a heavy feeling during walking. Many older adults assume this is arthritis or simple fatigue. But when arteries in the legs begin to narrow, the muscles don't get the oxygen they need during movement. That heaviness is not just aging, it's a sign that circulation is struggling to keep up with your activity. Sometimes, seniors tell me they need to stop halfway down the block because their legs just feel tired today. Yet that tiredness is often one of the earliest clues of reduced blood flow. Numb or cold feet are another sign that gets brushed aside. Seniors often blame poor circulation, the weather, or even their shoes. But coldness that persists, especially when one foot feels colder than the other, can indicate that arteries feeding the lower body are narrowing. When the heart can't push warm, oxygenated blood down to the feet, the body responds with coldness or numbness. It feels like a minor annoyance, but it can be a significant indicator of arterial disease. Mild chest pressure is another symptom that's easy to ignore. It doesn't feel like the dramatic chest pain most people expect from heart problems. Instead, it feels like a gentle weight or tightness that comes and goes. Some seniors say it feels like indigestion or a bubble under the ribs. But the heart can send early distress signals long before a true heart attack begins. These soft pressures, especially when they appear during activity and fade with rest, can be the heart whispering that its oxygen supply is being restricted. Shortness of breath is another early sign. You may notice it while climbing stairs, carrying groceries, or even making the bed. This isn't about being out of shape. When arteries narrow, the heart must work harder to pump oxygen-rich blood to the muscles. If the heart can't keep up with the body's demands, breathing feels harder. It might be subtle, but it's meaningful. Dizziness when standing is something many seniors consider harmless. They assume it's dehydration or low blood sugar. Sometimes that's true, but repeated episodes can mean that blood pressure drops too quickly or that the heart is struggling to maintain circulation when the body changes position. This kind of dizziness often appears when arteries can't adjust fast enough. Slow wound healing is another hidden sign. When blood flow is impaired, even small cuts or bruises take longer to recover because the tissues don't receive enough oxygen and nutrients. Seniors often think their skin is just aging, but slow healing is one of the clearest reflections of poor circulation. And of course, fatigue that cannot be explained by activity is one of the most common early warnings. This isn't the normal tiredness after a long day. It's deep, persistent exhaustion that shows up unexpectedly. Seniors often tell me they feel unusually worn out from simple tasks like folding laundry or making breakfast. When arteries can't deliver enough blood to the muscles and brain, the body slows down to conserve energy. What all these signs have in common is that they are subtle. They appear gradually, they feel familiar, and because they are so easy to attribute to aging, Many older adults never mention them until they worsen. But once you learn the meaning behind these sensations, you begin to see how the body communicates long before a serious event occurs. Now that we've identified these overlooked warning signs, the next question becomes even more crucial. What daily habits are quietly accelerating this arterial damage without seniors realizing it? Daily habits that damage arteries faster. As we continue this journey into understanding arterial health, it's important to recognize that warning signs don't appear in isolation. They often emerge because of daily habits that slowly but steadily place strain on the arteries. And the surprising truth is that many of these habits feel ordinary, familiar, and harmless. I've met countless seniors who believed they were doing fine, only to discover that small patterns in their everyday lives were accelerating artery damage without them ever noticing. One of the biggest culprits is a high-salt diet. Many older adults don't realize just how much hidden salt is in canned soups, frozen meals, sauces, breads, and snacks. A meal that tastes mild can still contain more sodium than the body needs in an entire day. Salt pulls water into the bloodstream, increasing volume and pressure. Over time, this constant pressure wears down artery walls and forces the heart to work harder. Seniors often come to me shocked that their blood pressure is rising, even though they haven't changed their diet. The truth is, their diet may have been high in salt for years without them realizing it. Sugary processed foods also play a major role. Foods like pastries, sweetened drinks, packaged snacks, and cereals send blood sugar levels surging. When this happens repeatedly, the inner lining of the arteries becomes inflamed. Inflammation makes it easier for cholesterol to stick, forming plaque. Many seniors enjoy sweets as small pleasures, not realizing that these daily indulgences can quietly accelerate arterial aging. A sedentary lifestyle is another silent threat. After retirement, routines often shift. Days become slower, and sitting becomes easier than moving. But when the body stays still for long periods, circulation weakens. Blood flow slows. Arteries become less responsive. Muscles that help pump blood back to the heart lose strength. Movement isn't just good for the heart. It's essential for keeping the arteries flexible and healthy. Smoking, even if it was decades ago, continues to affect arterial health. Many seniors who quit long ago don't realize that the damage from earlier years can linger through reduced elasticity and lingering inflammation. And for those who still smoke or live around smokers, the impact is even stronger. Every breath of smoke irritates blood vessels and constricts arteries, forcing the heart to work harder than it should. Poor sleep is another habit that quietly harms arteries. When the body doesn't rest well, stress hormones rise. These hormones tighten blood vessels and increase pressure. Over time, chronic poor sleep makes the arteries less flexible and more prone to plaque buildup. Seniors often assume waking up multiple times at night is simply a part of aging, but the truth is that sleep quality is deeply connected to arterial health. Chronic stress has a similar impact. Worrying about finances, family, health, or loneliness sends the body into repeated stress responses. Every stress spike tightens arteries and increases inflammation. Most seniors don't think of stress as a physical threat, but the heart feels every moment of it. Dehydration may seem small, but it thickens the blood slightly, making it harder for the heart to pump. Many older adults lose the feeling of thirst as they age, so they simply don't drink enough water. Even mild dehydration can increase fatigue, dizziness, and circulation problems. And finally, a simple lack of movement makes all of these issues worse. Movement stimulates a chemical reaction in the arteries that helps them relax and widen. Without it, arteries become stiff and narrow. Even short periods of walking or stretching can greatly improve circulation. Yet many seniors underestimate how powerful these small habits are. When you step back and look at these habits together, you can see how the body's signals make more sense. The hidden warning signs from Cluster 2 often appear because these daily patterns have been slowly weakening the arteries over time. The good news is that habits can change, the body can respond, and arterial health can improve at any age. And that leads us to the next essential part of this journey. Now that we understand the causes, what can seniors actually do to protect their arteries, strengthen circulation, and regain control of their health? What seniors can do to protect their arteries. By now, you've seen how everyday habits quietly shape the health of your arteries. The reassuring truth is that while these habits can cause damage over time, the body is also wonderfully capable of healing when given the right support. Even after 60, the arteries can grow more flexible, blood flow can improve, and symptoms can ease. I've seen this transformation in countless patients, and it's one of the most hopeful parts of caring for older adults. You are never too old to benefit from change. One of the most powerful steps is simply walking. You don't need intense workouts or long hours at the gym. A gentle 15 to 30-minute walk each day can increase circulation, improve oxygen delivery, and help the arteries relax naturally. When your muscles move, they signal your arteries to open wider and allow more blood through. It's a beautiful example of how the body responds to even the smallest act of care. Many of my patients who started with slow, short walks found themselves feeling more energetic within just a few weeks. Hydration is another essential part of artery protection. Water keeps the blood flowing smoothly, making it easier for the heart to do its job. Many seniors underestimate how important hydration is, especially because the feeling of thirst decreases with age. When you don't drink enough water, your blood thickens slightly, forcing the heart to pump harder. Carrying a small water bottle or setting reminders throughout the day can make a tremendous difference. Your diet also plays a powerful role in artery health. Increasing fiber, vegetables, fruits, and healthy fats like olive oil, nuts, and avocado helps reduce inflammation and stabilize cholesterol. These foods nourish the lining of the arteries, making them more flexible and less prone to plaque buildup. Reducing sodium is equally important. You may not taste the salt in processed foods, but your blood pressure can feel it. Lowering sodium intake helps ease the pressure on artery walls and supports better overall circulation. Managing stress is another key factor. Stress hormones tighten blood vessels and raise blood pressure. Simple practices like slow breathing, gentle stretching, listening to calming music, or taking a few minutes to sit quietly can relax your nervous system and reduce strain on your arteries. You don't need to meditate for an hour. Even a few peaceful breaths throughout the day send a message to your heart. You're safe. You can relax. Good sleep is just as essential. When you sleep well, your blood pressure naturally dips, giving your arteries the rest they need. Creating a bedtime routine, dimming lights before bed, and avoiding screens can help your body settle into a healthier sleep rhythm. Many seniors notice improved energy, mood, and circulation simply from improving their sleep habits. Regular checkups are another powerful tool. Knowing your numbers, your blood pressure, cholesterol, A1C, calcium score, and ankle brachial index, gives you a clear picture of your artery health. These tests are simple, but they reveal information that can prevent major events. I always tell my patients that prevention begins with awareness. When you know what's happening inside your body, you have the power to make informed choices. Movement itself is one of the most transformative practices, not just for your heart, but for your arteries. When you move, your body releases nitric oxide, a natural chemical that relaxes and widens the arteries. This simple scientific reaction is one of the reasons walking, stretching, and gentle exercise are so effective. With every step you take, you're helping your arteries stay flexible and strong. And here's the most important truth of all. Protecting your arteries isn't about perfection. It's about consistency. Small steps create big changes over time. Your heart responds to every bit of attention, every healthy choice, every breath of calm, every walk around the block. The body is always listening, and it always wants to heal. Now that we've explored what you can do to strengthen and protect your arteries, our final step is understanding when these symptoms are no longer safe to ignore. Knowing when to seek medical help can save your life. When seniors should see a doctor. Immediately after learning how to protect your arteries and support your circulation, There's one more piece of this journey that matters deeply. It's knowing when your body is no longer whispering, but truly calling for help. This is where awareness becomes life-saving. I've seen many older adults delay medical care because they didn't want to overreact, or they believed the discomfort would pass with rest. But arteries don't wait, and neither should you when certain signs appear. One of the clearest signals that something is wrong is chest discomfort. It doesn't have to be dramatic or crushing. Sometimes it feels like a pressure, a burning, or a tightening that sits behind the breastbone. If it shows up during activity and fades with rest, that's a major red flag. It often means the heart isn't getting enough oxygen. And if that sensation lasts more than a few minutes or keeps returning, it's time to act. Not tomorrow. Not later in the day. Now. Sudden shortness of breath is another urgent sign. You might be carrying light groceries, walking across the room, or climbing a few steps when you feel a wave of breathlessness that doesn't match the effort. This can mean the heart is struggling to pump effectively. Many seniors assume they're just out of shape, but the heart often sends this signal long before a serious event occurs. One-sided weakness or numbness in the face, arm, or leg is a sign that blood flow to the brain is compromised. This could indicate a stroke, which requires immediate medical treatment. Even if the weakness fades quickly, it's still a warning that something is interfering with circulation. Severe leg pain during walking is another sign not to ignore. If the pain forces you to stop, or if it feels sharp and sudden, it may indicate that blood flow to the legs is severely restricted. Seniors often dismiss this as arthritis or muscle strain, but when arteries in the legs are blocked, every step becomes a struggle for oxygen. Sudden coldness in the feet or hands, especially when one side is noticeably colder, can also be a sign of impaired circulation. This shouldn't be brushed aside as poor circulation. It can be a clue that an artery is narrowing more dangerously than you realize. An irregular heartbeat or fluttering sensation in the chest is another warning. The heart depends on a stable rhythm to pump blood efficiently. When that rhythm changes suddenly, it can reduce blood flow to crucial organs and increase the risk of stroke. And dizziness, especially if it comes with blurred or blacking vision, is one of the body's most urgent alarm bells. This can mean the brain isn't receiving enough oxygen, often because of sudden blood pressure changes or impaired circulation. Seniors may shrug it off as dehydration, but repeated episodes should never be ignored. When any of these signs appear, the safest response is immediate action. Don't wait to see if the symptoms disappear. Don't assume it's nothing. And don't try to diagnose yourself. Call 911, especially if chest discomfort or sudden shortness of breath is involved. Early intervention saves heart muscle, prevents long-term damage, and dramatically improves recovery. The moments you act quickly can become the moments that save your life. Your arteries and heart are always speaking to you. They send gentle signals, subtle warnings, and sometimes loud alarms. Listening to them, responding promptly, and seeking help when something feels wrong is one of the strongest forms of self-care you can practice. With this understanding, we're ready to bring everything together. In the final part of our video, we'll step into a more emotional space, a moment to reflect on resilience, hope, and the incredible strength within your body as you grow older. Let's move into the conclusion and close this journey with confidence and gratitude. As we come to the end of this journey together, I want you to remember something simple and powerful. The symptoms we've discussed today are not random. They are not accidents. They are early messages from your body, gentle signals asking for your attention long before a crisis arrives. Your arteries, your heart, your entire circulatory system are always trying to communicate with you. And when you learn to listen, you give yourself the chance to protect the life you cherish. I hope you feel encouraged by the truth that your body is resilient. Even at 60, 70, or 80, your arteries can strengthen, your circulation can improve, and your energy can return. I've seen it happen countless times. With the right care and a bit of patience, remarkable changes take place. The body wants to heal. It wants to support you. It simply needs a little help along the way. And the steps that lead to better health are not complicated. They're small, gentle choices that add up day after day. A short walk, a glass of water, one meal with more vegetables and less salt, a moment of calm breathing when stress rises, writing down a symptom instead of ignoring it. These simple acts are more powerful than they seem. They protect your future and give your heart the strength it needs to keep going. Before we close, I want to thank you for spending this time with me. Your willingness to learn and care for your health means more than you know. It shows courage, it shows hope, and it shows a deep commitment to yourself and the people who love you. I hope you leave this video feeling empowered, encouraged, and a little more connected to your own body. If this message spoke to you, I invite you to stay with our community here at Senior Health Daily. Subscribe, stay informed, and let's continue walking this path together with gratitude, confidence, and compassion. Your heart deserves that and so much more.